Dementia is caused by damage to brain cells. There are different types of dementia. You've got vascular dementia, Alzheimer's, you've got mixed dementia, which is more than one type. You've got Lewy bodies dementia. Also, you have frontotemporal dementia. The local Leeds perspective on dementia at the moment is we've got 8,500 people affected by dementia. But there's an estimation from Leeds City Council that we will have by 2030 with an increase of 8% being affected. And that will be a higher than average prevalence within the African Caribbean and other BME communities as well. The impact on BME families is one where it creates isolation and loneliness and stress as well, because you've got carers that will be looking after whether it's their older generation, and sometimes we have young carers as well who do not have an understanding of the symptoms or the signs of dementia, or even the outcomes of dementia, where parents may go out and they will forget names, but they may forget streets, so they may go to the market one day but not return home. And because it's culturally taboo, we don't talk about it, and because we classify it sometimes as she's mad, or she's gone something to her, or somebody does something to somebody across the communities, then we don't talk about it. So it creates a level of isolation and loneliness.
It's a gradual thing. You don't wake up with 90% dementia. It starts at a low end. It affected me in too many ways to list, because every day was different. Every day was a different challenge. As it progressed, as her dementia progressed, the issues progressed, the effect it had upon me personally progressed, and things that you didn't think you'd have to face, you had to face. Things you didn't think would ever affect you, ever concerning your mother, affected you.
The impact on family carers, family members who are carers, can be vast. You're backwards and forwards, you're helping with the washing, the cleaning, the ironing, the cooking, the shopping, and it's draining. It can be really, really draining on you as an individual.
The emerging needs for BME communities regarding dementia will include raising awareness through targeted work within those specific communities, education, which is twofold, which is frontline services as well as within communities with carers, with young people who are also looking after their older generation as well, to reduce isolation, also support to create dementia-friendly communities.
When working with people from the Black community, I think it's really important that the professional people understand their cultural backgrounds and their cultural needs.
The dementia puts the patient, such as my mother, in that mode in their head where they can't help it, they don't mean it, they're not being nasty, they're not being racist, they're not being choosy, they're not being biased. It's the dementia. They want to see and talk with someone of their own culture.
When they saw me as a Black person, they would identify with me because we're same colour. It could be that they're from a different island from me, but I made that connection straight away, and they wanted to work with me. They wanted me to help them to, whatever they needed.
Listening is important. Food is important. How you dress them is important.
And I think importantly with dementia, and I probably speak as a bit of a professional here, is to recognise that the biggest impact is on families, some carers, and that's immediate families, but actually in some cases that extended family as well. The delivery of care by carers is significant. Without that, the health service, the social care services would collapse. We really do recognise that, and what we want to do is to make sure those families are properly supported, get good information. Carers themselves should be getting good services, and they should be supported to support that person as much as possible.
It's really important that public services should work with grassroots organisations, people who are facing the people with dementia on a daily basis, people who are actually doing the work.
On a whole, the public service, what I think they can do further, to add further, is listen to their staff. Because you build a relationship with the staff. If you've got a member of staff that's coming to, to my mother's and looking after my mother for 6 months, you build a relationship with them. And they complain and they moan about certain things, which they're entitled to do, and they're not listened to. At the end of the day, they're the ones that's coming in and having to do all the hard work. the bathing, the cleaning up, taking abuse, whatever is going on under that roof.
I would like to see from the authorities that they actually take up the training to be culturally competent in their delivery and understanding where BME communities sit with dementia. In various communities, there isn't even a word for dementia. So when confronted with it or diagnosed with it, the word dementia means nothing to them. So they have to become culturally competent when they're dealing with BME communities.
The Leeds Dementia Board is the multi-agency board tasked with delivering the Leeds Dementia Strategy, Living Well with Dementia. So that covers everything from prevention, the sort of public health agenda, ensuring early diagnosis, ensuring early, good, strong community support, all the way through more intensive support such as home care, care home support if that's appropriate, extra care, ultimately for some people into end-of-life care. And to deliver that, it's really important that the board is made up of a broad range of organisations, so that's the NHS, adult social care, other parts of the local authority, a very strong third sector, and of course, crucially, representatives of people with dementia and their carers, and to make sure that we do our planning and delivery in co-production, working very closely with families, with people with dementia, with those communities affected, to inform and to deliver the plans that we're trying to achieve.
People with dementia, well, my mother, should I say, is a very good timekeeper. So if you say it was a big issue, this. If you say you was coming at 1, you had to be there at 1, because for some reason numbers has a lot of meaning with them. I understand why certain family members will laugh at them, because they're actually finding it difficult to deal. That's their reaction to what's happening at that time. Steer that other family member from laughing at them and get them to only laugh with them if they're going to laugh, because they're aware, my mother and dementia people are aware of when you are laughing at them, and that has a massive effect upon them. Try and work as a unit, try and make decisions together as a family, and anything you got to discuss about whichever family member is suffering with dementia, don't do it in the same room as them.
I think at the heart of that is recognising the importance of carers and also communities. So carers are the ones who carry much of the burden, much of the work around supporting people with dementia. I think it's our role to make sure that those people are properly supported. And of course, through those communities, that people live in those geographical areas or communities of interest. I think there are particular issues around some of the BME communities and how they can engage in this and really support people within their communities, all with the aim of trying to keep that person as engaged and as supported and as independent as possible, to try and live as good a life as possible whilst having dementia.
In regards to supporting dementia, BHI is a Befriend Us programme where we'll provide volunteers, trained volunteers, to actually support not just those living with dementia, but the carers as well as providing a dementia-friendly what we call Fusion Cafe, where they come and we look at their diet, we look at their nutrition, we look at their exercise, but we also invite statutory organisations to come in and share with how they can support them on their journey as well.
I'm here just as a means of, again, getting these people active, getting them all moving, having a good time with it as well, just enjoying themselves. Everyone seems to really enjoy it. It's hard work, obviously, but everyone enjoys it. That's part of the reason why they do come down here as well, because they might not be able to get something like this anywhere else during the week. So when they come here now, it's a social interaction, the food, all the different games we're playing, and they have the exercise as well. So.
The local networks available in Leeds, we have an Alzheimer's Society, we've got a Dementia Society, there's BHI of course, and there's Touchstone, Leeds Irish Health and Homes, all working together for the BME communities to actually look at the reduction and support of those living with dementia and the carers.
BHI, they're a really good model and a role model for other organisations to look at and also follow their practice in the community.
BHI is needed. They give a good service, they give good information, they keep good seminars, and as a whole, I think BHI is doing a good job.
My vision for the next 5 years with regards to dementia is to raise awareness and to campaign to ensure that we have equity of access to services with dementia for our BME communities as well. So that means more training, more awareness raising, more campaigning and more education as well. And to provide local community-led services within our communities which are dementia friendly.